All right, the type of cancer I had was squamous cell carcinoma, stage 2, on the base of my tongue. The way it was discovered is I had a tumor in my neck, which I had surgery on, and when it was removed, they discovered that there were two other pieces attached to it. They tried to take out the second one, which they were successful, and the third one was stuck to the base of my tongue, therefore it could not be removed. And the only course of treatment was chemo and radiation. Once the tumor was removed, it was sent to the Mayo Clinic in Arizona, where that's where they discovered that they were cancer cells inside of it, and that I should start treatment as soon as possible. So when I decided to do the treatment and I went through it, right away I discovered that swallowing was going to become an impossibility. Why? Because when they radiate your neck, it's very, very, very hard to swallow. It's almost impossible. And they prescribe some liquid that's called magic mouthwash that you're supposed to gargle with prior to eating, but it's almost impossible to swallow anything at all. Because if you can imagine, the pain is so severe that it would be the equivalent to having your throat on fire from the radiation. So the only other option was to do what's called a TPN, and that is to be fed through a tube in my arm. Because at that time I was stubborn and thought I could try to swallow either way, and I found out that it was impossible. And the other option was to do a feeding tube through my stomach, but I rejected that tube. And only then did I discover that I was dangerously close to starving or starving to death. So they had to install the tube in my arm right away and start feeding me through that route. Um, as soon as I started treatment and I discovered that it was impossible for me to swallow, obviously the weight came off really quick. And I went from 210 pounds all the way to 145 pounds during my treatment. So we're talking about a month. So in 1 month, I dropped from 210 to 145 pounds. All right. We discovered that I had the tumor in July of 2010, and then shortly after that, I started looking into options, and I didn't go into full treatment until November of 2010. The treatment lasts anywhere from 30 to 45 days. So once I ended my treatment, my follow-ups consisted every 3 months of going to an ear, nose, and throat specialist. And what he does is he numbs the inside of my nose with a spray, and then he sticks a long camera up my nostril and down my throat, and it's projected on a big screen TV where he goes ahead and looks for any signs of the tumor that has returned. So, not only do you have a struggle going through the treatment itself, but afterwards, there is a really big struggle, and that is realizing that your all the follicles and your neck area are fried, and all the way around the back of my head, I have like a line or a patch where hair will never grow back. for that reason, because of the radiation treatment was so bad, it just burned everything. Then you have the struggle of learning how to eat or swallow again, because the pain was so severe that just swallowing anything normal, uh, I was convinced that I would never be able to swallow again. So I was in such pain because of that. I had to also seek treatment through a therapy to learn to swallow again. On top of all that, you have what's called severe dryness or dry mouth, and the salivary glands cease to exist. And even though I tried different types of medication to get those glands to respond, it didn't work. So having constant dry mouth is an obstacle. And then of course that also leads to dental problems. So I constantly have to be visiting the dentist to make sure my teeth are in order.